Perfect. So hi, everyone. As you've heard, my name is Gulnar Feerasta. I use she and they pronouns, and I have the honor of serving as the Senior Director of Programs at the LGBT Community Center of Greater Cleveland. So I'm just going to dive right in. When we started thinking about this topic, we thought it was really important to begin from like a assets-based approach, and to think about what are some of the inherent strengths of our community and those that we serve. So as most historically marginalized communities, because we couldn't get support outside, we've had to build really strong inter-community support systems and mechanisms within our own community, which is also a really great strength. We have a legacy of resilience. We're very versatile, adaptable. We've had to be throughout historically. And then advocacy skills. I feel that our community brings really strong and vital self-advocacy skills, as well as which sort of cuts across all intersectional identities and communities. So some of the challenges that we have found in terms of access to healthcare for the LGBT community through our research and just our programming and what we try to do, which is where we try to fill some of the gaps. There is a lot of systemic and structural discrimination. Homophobia, transphobia, racism, et cetera. One of the key things that really stands out there is also the invisibility of bisexual people. They get really dismissed and disregarded when trying to access care. There's a legacy of pathologization by the medical model. Usually there's like a diagnosis for everything, but it feels very much like if we can just fit you in a box and then we'll have like a really easy cookie cutter solution to fix you. There's a lack of appropriate representation within healthcare providers. So not only is it really, really challenging to find affirming healthcare providers, but to find healthcare providers that identify as part of the LGBTQ+ community is almost impossible at times. There are folks that are LGBTQ that exist in the healthcare systems, but due to all the barriers and all the discrimination and the gatekeeping, it's really hard, to find someone that you can relate to or who's going to understand your lived experience. This also ties in with stigma, as well as the historical experience that when we have tried to advocate or when we have tried to present a solution to partner to improve access to care in all systems, but especially the healthcare system, there is an inherent resistance to receiving education on how to better serve marginalized populations. I think, and that's all marginalized populations. And there's also sort of this inherent dismissal of wanting to learn and do better. So those are some of like the key challenges that we have found. So how does the center fit into this landscape? We try, our whole goal is to make things, to create equitable access to supports and resources for our community. And it's not just, access for the sake of access, but equitable access to high quality healthcare resources, because everybody deserves high quality, not just, access for the sake of access. So we partner. A lot of what we do at the center is we are not a direct service provider or a health and human service organization in the traditional sense. We truly are a community center, and we act as a convener that brings people together and in a space that we create for service providers to be able to offer those services in an environment that is safe and affirming and inclusive for our community members. So that includes STD, HIV testing and treatment. We, of course, have the amazing Pride Clinic here with Metro Health at the center, where the doctors are from the community. And it has made a huge difference in terms of creating community-based access to preventive care, to primary care, linkage to affirming providers. So if there's something that folks can't get connected to through the private clinic, or they are looking for affirming mental health providers or surgical care, things like that, we have a directory of providers that we can link folks to and do a warm handoff. Mental health support groups. So we work with the community. We have many different peer-to-peer support groups and others that are facilitated by mental health providers. For example, we have a grief group. We have a group that is for folks that are neurodivergent, and part of the community, groups that support folks on the autism spectrum, et cetera. We also have recovery support beyond just the traditional AA. So we have an LGBTQ specific AA group that meets here, but also Smart Recovery and other non-denominational based recovery programs. We support folks with navigating systems, with doing advocacy for patients when requested, and provide support around basic needs, food, housing, transportation. If we're not able to provide that directly, we definitely make sure that folks get connected to what they need. And all of this sort of filters into overarching what I have at the bottom there, community belonging. So ultimately, we think of care as through the lens of social determinants of health, because everything is healthcare, food is healthcare, housing is healthcare. And so ultimately, all of those, having access to all of those things in a place where you can go and feel welcome and be your authentic self creates a sense of community belonging, which is also a social determinant of health. And so these were some of the opportunities that we think that could support in providing, making things better. So we want to be engaged in meaningful partnerships with institutions. I put housing specific, LGBTQ specific housing support up there because to me, housing is a huge part of healthcare. And Cleveland is considered to be a metropolitan city, a major metropolitan city, but we have no LGBTQ specific housing support, emergency shelter, permanent supportive housing, nothing. And so when you think about the different disparities that different identities face, but when you combine all of those and you have this intersectionality of identity, there's also further compounding of all of those disparities and adverse outcomes. We love having folks come into the center to provide information and workshops to our program participants. We're really concerned about access to insurance. And so what can we do to remove those insurance barriers to ensure that people have access to appropriate holistic care? Ultimately, we want to collaborate to create equitable access to high quality healthcare and address the root causes so that we're not being reactionary, but we are being preemptive.